Hi, I'm Don Wynn. I'm going to be talking about systemic sclerosis, lung disease, also known as scleroderma. This is an autoimmune disease of connective tissue characterized by excessive collagen deposition in the skin and internal organs, particularly the kidneys and the lungs. For our purposes, we're going to be talking about the lungs. And its course and complications can be chronic, can last a few months, but it can also occur through their lifetime and never be cured. Histologically, you'll see a distinctive, widespread vascular lesion characterized by endothelial abnormalities, as well as proliferative reactions of vascular intima, which is a significant factor in changing the terminology from scleroderma to systemic sclerosis. Because today, we just look at the word scleroderma and to refer to thickening or hardening of the skin. Subtypes are briefly covered on this slide. It can be limited, diffuse, or mixed, and there's a breakdown of each. The etiology of systemic sclerosis is mainly idiopathic, but has been theorized or hypothesized to be caused by mycoplasma, autoantibodies, cytomegalovirus, placental transfer from the mother, trophaneurosis, severe emotional shock, or occupational exposure, either from silica, vinyl chloride, organic solvents, or chemicals. How does it affect a person? It can be the pathogenesis of this disease is inflammation caused by T cells. Cytokines results in alveolitis, severe thickening and obstruction of vessels resulting in pulmonary hypertension and renal failure, then causes cutaneous fibrosis, and then hypoxia reperfusion injury produce free radicals that cause endothelial damage, intimal thickening, and fibrosis along the activation of antioxidant enzymes. The body function is what you would see in the clinic, and that would be dyspnea on exertion and non-productive cough. The incidence of systemic sclerosis is 20 out of a million new cases a year. More than 50% of systemic sclerotic patients die of pulmonary disease. The prevalence of interstitial lung disease is 25 to 90% of those diagnosed with systemic sclerosis. You're more likely to have this condition if you're a black female between the ages of 20 to 60. We haven't really found a gold standard for treating systemic sclerosis, and we need further development to find that. But there have been a few things that have been used and have helped to a certain extent, and that's immunosuppressive therapy, corticosteroids, monoclonal antibodies, and antioxidants. We can also do a lung transplant on the patient. A survey done in New York states that nurses, and not PTs, are the main clinicians writing exercise programs for patients with systemic sclerosis. This means that we need to take the initiative to help these patients. Cross-sectional studies found a direct correlation of pulmonary diffusion rates and body height to a 6-minute walking distance. These tests and measures will help individualize your exercise program intensity for these patients. There has been a recent study that have found a positive impact to try to treat these patients with vocal intervention of pronunciation and vocal improvisation with either music or speech. Systemic sclerosis touches on a few topics we mentioned in class. As we mentioned earlier, it's a fibrosis of the lungs, which is categorized under the restrictive lung disease. This decreases lung volumes, and as we mentioned in class through this flow chart, to ventilate we bring atmospheric oxygen, bring it into the lungs, into the alveoli, and then from there we need to diffuse the oxygen from the alveoli into the arterial blood. And this is where we would have a problem, because there would be an increase in thickness due to the fibrosis, which would decrease diffusion. And from Fick's law, we understand that we would have a hard time of extracting that oxygen into the blood. And these are my references. Thank you for listening. Have a great day.